So I do several things. I run a treatment program where we help people with alcohol and other addictions. And also I conduct research to find medicines and other treatments to help people with addictions. And I also spend time helping to educate other healthcare professionals in terms of good evidence-based treatments.
Now, according to new data, over half of alcohol use disorder is diagnosed after a crisis occurs, whether that be an emergency room visit or a DUI or even in some cases a crash. Could you explain a little bit why that might be?
Yeah, it's unfortunate, but it seems that many people have to sort of crash their way into the system, that the alcohol use disorder is not diagnosed until people actually show up in an emergency room or if there's some crisis. Ideally, alcohol use disorder, which is a very treatable medical condition, should be diagnosed at routine physical visits, routine medical visits.
And when it comes to people who get diagnosed before a crisis occurs, only about 28% of people ever get diagnosed before something tragic happens or dangerous. Could you, I guess, talk about a little bit how we can get that number up and like ways we can improve that?
Yeah, so I think there's several things we can do. Number one, healthcare professionals need to screen for excessive alcohol drinking at routine visits. The VA hospital, for example, does that. There's several instruments that you can use to assess if someone's drinking excessively. And the second thing is we need to help people overcome sort of the shame and stigma associated with alcohol addiction so that people are more voluntarily will reach out and ask for help.
And when it comes to the holidays, it can be very, very stressful with all the travel and trying to see the family for the holidays and meeting, I guess, their expectations. What do you think goes into why the stress levels come up and how that can amplify accidents?
Yeah, so it's clear that alcohol drinking increases during the month of December. As a matter of fact, the highest rate of fatal car accidents is actually New Year's Eve, between 6 p.m. and 1 a.m. on New Year's Eve. And so there's a variety of factors why people increase their drinking. Some people drink because they're celebrating. Other people drink because they're stressed or depressed, sometimes for both reasons. And so the holidays are a really dangerous time for excessive drinking.
And if something dangerous or tragic were to happen and there was an emergency room visit, they have sort of become the default place for these screenings. I guess why has that been the case in your opinion?
Yeah, I think because it hasn't been picked up in routine visits. And again, people are not willing to come out and express that they have concern about their drinking. But having said that, the emergency rooms could be a good place where people could at least initiate care. So there's research to show that when emergency rooms get people involved with treatment, that subsequently people have better outcomes. That again, treatment is available, treatment is effective, and even if it's an emergency room where you get your first diagnosis, it's still important to follow up with care.
And you previously mentioned the stigma around having a drinking problem, as someone say, and it might be hard for them to admit that, but how can primary care providers in initial testing or screenings, how can they sort of look for risk factors before an incident occurs?
Yeah, so the main risk factor to look for is people who say that when they start drinking, they have trouble controlling how much they drink. And you can do that with a simple question. You can ask people over the past 30 days, how many days have you had, say, five or more drinks in one setting? And if people report that they've had a couple of days like that or more than that, then that's a huge red flag that maybe people need to re-examine their relationship with alcohol and to consider that maybe they have a drinking problem.
And for people who have might have a friend or a loved one who they recognize has a drinking problem or is developing one, I guess in your opinion or advice, what would be the best way to try to help them out or at least lead them in the right direction?
Yeah, so it's important not to take a judgmental approach. People already feel bad enough about their drinking. You don't have to make them feel worse and make them feel like they're have poor willpower or there's something psychologically wrong with them. That it's a medical condition and a medical condition that's very effective and treatable. If you're a family member, what you can do is point out how their drinking is leading to these adverse consequences and tell them that if they get help, here's some of the good outcomes that could occur by getting help.
And what treatment or help options are available for people in need?
Yeah, so there's certainly referrals to peer support groups. But in addition to that, there's good psychosocial treatments that are effective. And also there's FDA approved medications that have been proven to be very effective in reducing craving and heavy drinking. And those medicines include naltrexone, which you can take either orally or as a once a month injection. There is a acamprosate and disulfiram.
And where can people learn more information about everything you just mentioned?
Well, you can certainly, there's plenty of places on the web that you can search on that. You can go to my website at the Institute of Addiction Medicine.org. Or if you're looking for help, you can go to SAMHSA. They have a website where you can type in your name and address and they can refer you to treatment programs.
And is there anything that we didn't cover today that you wanted to touch a little bit more on?
Yeah, just that you don't have to earn treatment in a crisis. If alcohol is costing you sleep, mood, health, or you just don't have control over your alcohol use, ask for screening and a plan.
And are there any tips you could give for people who might want to look to substitute it with something just so they can kind of combat that thirst?
Yeah, so fortunately, there's plenty of non-alcohol beverages that one can use, and they're becoming increasingly popular. And so you can use the non-alcohol beverages and keep in mind that it's okay not to drink. Even when you're in a social function and other people are drinking, it's okay to say you're not interested in drinking. You don't have to keep up with other people.